Hi, I'm Dr. Julie Steinauer, and what does the flu have to do with your vision? Oh my goodness. This is something that I hear about with some frequency, and honestly, something similar happened to me. So let's break it down and talk to an individual who had an experience with having the flu. This could happen with a cold. A common cold. It's very common with any kind of virus that your body gets, that the end result could be problems with binocular vision. Now, I'm going to break down a couple different scenarios for you. Scenario number one is that after a cold or some sort of virus attacking your body, especially in kids if they've had a high fever, it's common for them, or I should say it's more common than what you would think, that they might develop strabismus or an eye turn. These are situations you want to get to a developmental optometrist right away to stop that from occurring. And you want to stop it from becoming something that's permanent. Because often after they've had some sort of sickness, they will have an eye turn that develops that's intermittent. When it's in that intermittent phase is the time that you need to get it addressed. Don't just jump into strong glasses because it will turn permanent. So it will turn constant. And that is much, much more difficult to correct and to treat. All right, so what you want to do, if your child happens to have a serious sickness where they have, maybe it's even just like a common cold and it's not that serious at all, but they just have the snots and the, scratchy throat or sore throat. And if that's the case, and all of a sudden you notice like their eye turn, what? He's got an eye turn. Don't go into glasses. Get to someone who knows what on earth they're doing about binocular vision, because it's important to stop this immediately. All right, here's scenario number two. Scenario number two is an individual who had the flu. After the flu was over with, they had a resultant ringing in the ears, kind of like a vertigo, dizziness, some double vision, blurry vision, some headachy type stuff. And it just didn't go away. It stuck around. Now this one's going to be a little bit more of a leap for you to be able to take with your mind. but here's what happens. When viruses get into our body, they can actually stop and lodge in particular areas in our body. It's super common for them to lodge within the brain, brain stem, and spinal column. And we also tend to see some issues with inner ear as a result. So you can have mild swelling within the brain. It's almost like a toxic brain syndrome that comes out based on this, like this virus that left me. I no longer have the flu, but now it's really didn't leave me. It's stuck in my body somehow. Like, how do I get it out of my body? All right, well, there are methods that you do that. But let's talk today about what happens. What are the results? So if you've got like dizziness, tinnitus, which is like a ringing in your ears, okay, you have double vision, blurry vision, headache, all right, and this is usually more like a dull, achy headache. It's not like, oh my gosh, I feel like this is the worst headache I've ever had in my life. This is like the dull, achy, like banding headache around your head, more like this, and it's more like, okay. Then what has potentially happened is that virus is now gone like more latent or dormant in your body, but is still wreaking havoc in your neurological system, right? So it's gone latent from, it's not like expressing symptoms outwardly of like, I've got a sore throat or I'm coughing or I'm sneezing or I've got, lots of mucus and stuff coming. But now I'm like sick or have a fever, none of that kind of stuff. Now it's like affecting your body neurologically inside. All right, so if that's the case, one, you have to work at eradicating the virus from your body, which we can talk to you about that, give us a call. But two, you also have to work on whatever's left with the visual symptoms. So a lot of times it will be a strabismus or an eye turn, and it might be so slight that it's barely noticeable. In that first category, those kids that get ultra sick, their eyeballs turn in a lot. Usually in, although every now and then it's out, but most of the time it's going to be turned in. And that is very, very common. in this category, it might be just a minor eye turn, something that's so slightly, no one can hardly see it, but it's there and is causing problems, right? So vertigo and, you know, like, oh, I'm not comfortable with driving, or, you know, I've got this like constant ringing, or I feel like my peripheral vision is like kind of crowded in on me. I'm not real, you know, maybe even your memory is affected a little bit. And these are circumstances, again, we've got to get the virus eradicated from the body. That's a different method and something that I don't do, but I refer out for that. But then two, we have to address the resultant visual issues that are still hanging on there to get you feeling better. Okay, photosynthetics and light therapy is what we utilize in both of these categories, and vision therapy in both of these categories I've talked about already, in order to kind of stop the eye turn. It could be massive for that little guy or gal that just started intermittent like. We don't want it to get constant. And in this category, that minor eye turn, which they might even not say to you, I have an eye turn, but I just got over this illness and all these symptoms are still existing for me, or these new symptoms came up, right? So in those cases, again, photosynthetics, light therapy, and vision therapy are something that can help teach the brain how to utilize binocular vision again and get rid of the small, like micro strabismus that most doctors aren't going to see, and you're not going to see. And then the third category is similar, but it actually might be medication induced. In my particular instance, whenever I had a flu vaccination, I was introduced to a virus, and it had all of the kind of things that happened in that level 2 area, but a lot more. I won't go into all the details of that stuff because it would bore you with my body stuff. But we had so much that affected me. I had so much that affected me that lasted for years and years and years. And it was just doctor visit after doctor visit, test after test, all kinds of things. It traced through my whole body. It upset a lot of organs and body systems. And there was a ton of things that I had to do to eradicate it from my body. I also had resultant visual issues that I had to deal with. Okay, so whether you've got category 1 situation, category 2 situation, or category 3 situation, all right, 3 a little bit different because I wasn't sick, but I was given a flu vaccination, and that in turn made me sick. Okay, so any of those 3 situations, there are going to be resultant visual things probably at the end of that. And this is where we come in to help. So if something like this has occurred to you, to your child, or someone you know, if you know them well enough, I guarantee you've heard about it, because when I started going through this, I was telling everybody who would listen to me not to get the flu vaccine. And if it's happened to someone else where they've ever had that type of experience, it's serious for them, and we shouldn't discount it. Now, this is not a video that's going into like vaccinations and all of that, so please don't make it that for me. But it is a video to draw attention to the fact that it does cause issues for a lot of people, and you need to be very, very cautious about them. So if one of your family members, yourself, your child, or someone that you know has gone through any of these scenarios of super sick with a high fever, eye turn and stuff showed up, sick, maybe even just a mild cold or a mild flu, but a lot of visual complaints at the end of it. Or, like me, flu vaccination, and oh my gosh, all these crazy symptoms that just chased around the mountain to try and fix and correct. Vision problems, memory problems, body systems problems, organ problems, headaches, all kinds of things. If any of those things, you know about those, contact us. Call us at 618-288-1489 so we can talk to you about how we can help you visually. But also, if you're not local to us and you happen to be, I don't know, watching us from Pakistan today, then go to our website at visionforlifeworks.com and fill out the questionnaire, so that will come over to us and we can address things with you and find out how we can help you. There are things that can be done to help you resolve the visual issues that came about as a result of any of those 3 things. And with that, I'm going to say thanks for tuning in. Stay tuned. I've got lots more videos to come.